The latest news, updates, and more from the world of health and medicine. This is Medical Minutes.
Brought to you by Community Health Network.
Stroke is the focus of our morning checkup with Dr. Janelle Gordon, our medical expert. Thank you for being here with us today.
Thanks for having me, Scott.
She did the homework so you don't have to. The big changes from the folks who make recommendations. 80-plus pages that you combed through for us?
81 pages, Scott, from the American Heart Association and American Stroke Association for their updated guidelines for primary prevention of stroke or preventing a first stroke in an individual.
So out of those 81 pages, what do you want us to know?
So first I want to make sure we go over the warning signs of stroke. Because when we talk about stroke, time is life. So we like to go with the mnemonic B fast. So B is going to be balance. If you know yourself or an individual has any difficulty in how they're ambulating, we want to speak about eyes, so any changes in vision. F is face, so oftentimes patients will have maybe drooping in their facial expression. That's a telltale sign. Arm, so if you notice any numbness in your arm, if you're having difficulty raising one of your arms above the other, these are telltale signs. And then we also talk about speech, so either difficulty speaking or even understanding what someone is saying to you. And then T, that takes us to time. It's time to call 911 if a person is experiencing those symptoms.
I have heard in the past that it's as important for other people to be paying attention for those symptoms in someone else, because they may notice it before the person does.
The person may not even realize it. They could be thinking they're having just a typical conversation like you and I are having now and not know that their face is actually drooping, one of the arms is hanging oddly. So we need to make sure that we're paying attention to this in family members, friends, and even colleagues.
Is it something that could affect anyone? I ask that because we know there are risk factors.
Sure, there are a host of risk factors, and even more as I comb through this document. So the big ones: high blood pressure, high cholesterol, diabetes, if we carry excess weight on our frame, so overweight or obesity, but even some others, so individuals who are taking hormone replacement therapy for menopausal symptoms, more likely if they're 60 years or older and they've started these medications 10 years after the onset of menopause. Individuals who are taking hormones for gender affirming care are going to be at increased risk. Women who are pregnant with preeclampsia. There's a whole list that you can see in the article at wishtv.com later today.
You also found that socioeconomic issues can contribute to this as well.
Yes, so there's a big push for us to look more into the social determinants of health, which we know can affect the patient, even sometimes increasing the risk from some of those other conditions that are risk factors for stroke. So racism, discrimination, lack of access to nutritious foods, affordable housing, health care, so seeing a doctor like myself, even education.
When you do go to a doctor, what should the doctor be doing for you and talking with you about on this issue?
Sure. So I want to bring up a conversation that I had with a family friend recently who said that there was some difficulty controlling the blood pressure. And I said, well, what's the blood pressure that you're experiencing? 140s over 90s on medication, one medication that they've been on for years. And their doctor said, well, that's okay. No. The blood pressure should, and this individual I'd say is like around the 40s, should not be higher than 130 on the top, that's the systolic blood pressure, and 80 on the bottom. And a lot of individuals will need multiple medications, sometimes 2, 3, or 4 to control their blood pressure. But if we as healthcare providers work with the patient to do some lifestyle changes, then hopefully we can get you off of those meds and decrease your risk of having a stroke.
So there's some responsibility there on the patient, though, as well. What should we be doing to cut the risk?
I always say the patient is the most important person on the healthcare team. So there's a big talk about Mediterranean diet, but I also like to say there are other cultural ways of eating similar to the Mediterranean diet. We just don't have the large-scale studies on it. So by and large, you want half of that plate to be whole fruits and vegetables, okay? Not these veggie chips that I see out here.
Veggie chips are good, they just don't do what you need them to do.
But that's a snack, okay? We're talking about real food, lean proteins, watching your saturated fat, and salt reductions. And patients will tell me, oh, doc, I don't use the table salt. Not just the table salt, Scott. I'm talking about even your seasoning blends, your marinades, prepackaged foods like canned foods, frozen foods, boxed foods, etc. I'm not saying you can't eat them, but let's turn that package over and see how much salt is in there. If it's 1,500 milligrams for the day, I want individuals to be below 1,500 milligrams of sodium or salt for the day, especially if they have high blood pressure, because that will increase your risk of stroke.
Chefs who have an eye on people's health have been honest with us in the past. They say, well, you know why our hamburger is better than your hamburger? There's a bunch of salt in it.
Right.
So when you eat out, it's an issue as well.
We have to watch the eating out. But I will say the Culinary Institute of America is working with chefs across the country to be more mindful of the foods that we're presenting to individuals because of all the health care diseases that we're seeing.
Dr. Janelle Gordon, thank you. Important
Thank
information
you.
about stroke. You'll want to watch and read her article on wishtv.com later today with those links as well.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV. Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.